So, hemostasis. Hemo in this context referring to blood. Stasis would mean slowing or the stoppage of blood flow. Okay. So organisms, humans, we have got a closed circulatory system, meaning the entire blood is contained within a network of blood vessels and it kind of flows around. Imagine there is a breach in this circulatory system. So if there is a breach, there would be loss of blood. And that wouldn't bode very well for the organism now, would it? No. So the body has inbuilt mechanisms that prevent that kind of eventuality within physiological limits. And that is what one studies when one studies hemostasis. Okay, so you got a breach, you um, need to plug the breach, and once you plug the breach and the work is done, you need to remove the system that came into play in plugging the breach in the first place. So those entire mechanism comes under hemostasis. So hemostasis has got four components to it. Okay, so there are components that bring about hemostasis. Okay, the first component is the endothelium. Okay, so endothelium, what's endothelium? It's the inner lining of the blood vessels. Okay, so you got an inner lining, and that is the endothelium. Okay. So the second component is the platelets. So what are platelets? They are the formed elements, one of the formed elements of blood, um, which we have studied in one of the previous lectures. So the third component is the coagulation pathway. And the fourth component is fibrinolysis. So these are the four components that we're going to study as part of this lecture. So why should we even care for these four components? An understanding of these four components, which forms the bulk of this lecture, is the foundation for us to understand the antithrombotic agents. Okay, it helps us to understand logically the antithrombotic agents that are used in treatment. So which are these antithrombotic agents? So the antithrombotic agents that we are interested in are the anticoagulants, in terms of our discussion, we'll be first considering the antiplatelet drugs, and then we'll be looking at the anticoagulants, and then last but not the least, we'll be talking about the thrombolytic agents. So underlying an understanding of these agents is an understanding of the components that bring about hemostasis. And as I said, that is the bulk of this first lecture.